Hi everyone. I put together a few slides to review the concepts of simple, complicated, and complex intervention because it seemed like a lot of you had questions or uncertainties about them from your reading. So I hope this is helpful. Let's start with simple interventions. Simple interventions are have standardized steps and activities that generally lead to the same results pretty consistently. It's helpful to have skills related to implementing the steps, but they're not required. Simple interventions are usually limited to a single group or organization or even an individual, and require minimal change and adjustment to do it elsewhere. An example you might think of is baking a cake with a cake mix. You have the same ingredients every time. There are step-by-step instructions. You might get a little bit better at it if you do it a lot, but even if you've never done it before, and you can follow the instructions and get pretty consistent results. The only adjustment you might need to make is the cake mix box might give you some high altitude instructions that require an adjustment to the temperature or baking time of the cake. But either way, you're going to get the same kind of cake every time. An example in OT, I would say, let me qualify this, that I think most of our interventions are at least complicated, if not complex. But if I were to think of a simple one, from my experience, shoulder rehab for a partial rotator cuff tear has a pretty typical, straightforward intervention protocol. It typically would improve physical agent modalities and some combination of therapeutic exercise. Certainly we could make adjustments, but if the program is followed, if there's a program of stretching and strengthening and supporting that tissue recovery, you're pretty likely to get a good result. It works the same way in almost all your patients, and if you go to a new center, a new facility, it's going to work the same way in the patients there as well. So what makes something complicated? A complicated intervention is still dependent on having formulas or step-by-step instructions in some cases, but there are more moving parts to keep track of than in a simple intervention. It does require more expertise. Skill is a necessary component, but the outcome is still fairly predictable. We're not going to have a whole lot of variability in our outcomes. It may need a couple more tweaks if implemented in a new setting. So if I go back to my cake baking example, now I'm going to upgrade it to baking a cake from scratch with my 6-year-old niece. So I still have instructions, I still have a formula that's likely to lead to a good cake, but I need to keep track of measuring each of the ingredients, keep track of what's already been added, and I also have to monitor what my niece is doing. Because she's helping, I need to make sure she's putting in the right amount of whatever ingredient she's supposed to, that she's combining the ingredients at the right time and in the right to the right consistency as we go through the steps. But if I can keep track of that, we're still pretty likely to get a good cake. And the more experience I have as a baker, the better off we are. An example in therapy, you might think of a group intervention where you have a group protocol for a group program, but you're going to need to make adjustments to meet the needs of individual group participants, so it helps support reaching their goals. And it may not work quite the same way in different kinds of settings, so you might have to make further adjustments there. So if we get to a complex intervention, there's a lot more going on. The standardized steps and formulas may help. They may inform what you do, but they do not guarantee a consistent result every time. Expertise is important, but it's neither necessary nor sufficient to ensure a good result. It often involves coordination among multiple groups and organizations, and often they have competing priorities. Replication is challenging because there are so many context-based factors that go into a complex intervention that sometimes we miss the things that need to be replicated or adjusted for. If I take the cake baking example one step further, if you've ever watched one of those Top Chef competition shows where they tell people, okay, you have to bake a cake and you have like 16 ingredients and you have to make it out of whatever is there and have certain flavors, and so the person on the show knows what the goal is, they know the basics of how to make a cake, but they have different ingredients to work with than they may be used to. They have to adapt their knowledge. There are others in the vicinity who have different goals, and they have to keep track if they have an assistant working with them, what they're doing. There's the judges, there's other people involved. And an OT example is people with complex conditions. I'm thinking, in my experience, spinal cord injury and brain injury, where you're balancing what the patient's medical condition is, and sometimes they have multiple conditions at the same time. You're balancing what the patient's goals and as well as what the family, what their goals for the patient are. Then you have hospital administration, productivity requirements. You have insurance payment constraints. So there are a lot of layers of what's going on there. And even though we kind of we may have some idea of what the end goal is, and we may have done this before and know how to help people recover from these conditions, there's a lot of factors that really could change how the outcome goes. So I would encourage you, if you still want some further clarification, to just go back over the tables in Chapter 5, tables 5.1, 5.2, and 5.3. I think were all very helpful in laying things out and trying to compare the differences among these three concepts. If you still have questions, feel free to shoot me an email, or we can also reconvene on the discussion board, because if you have questions, it's likely other people in the class also do. I hope this has been helpful, and I will talk to you all soon.